Hello, my name is Lachey Baines. I'm the Outreach and Local Vendor Liaison Coordinator for the San Bernardino County WIC program. Today I'll be talking to you a little bit about WIC services, what we do, and who we are. WIC's mission is to provide all women, infants, and children healthy food and the knowledge and opportunity to make healthy choices in an atmosphere of dignity and respect, thus enhancing the potential for all Californians to enjoy a higher quality of life. WIC is a federal nutrition program that helps women, infants, and children up to age 5 by providing nutritious foods, information on healthy eating, lactation support, and referrals to healthcare. It was started to protect and improve the health of mothers and children, especially those from families in homes limited or uncertain availability of nutritious foods, which lead to hunger and poor health. For about more than 30 years, the San Bernardino County Department of Public Health WIC program has helped families, pregnant women, new mothers, infants, and young children get healthy foods, nutrition education, community resources at no cost to stay healthy and active. In San Bernardino County, we currently have 14 site locations found in multiple regions and cities. We have a variety of trained educators, specialists, and support staff who assist our WIC families. They include registered dietitians, health educators, health services assistants, lactation specialists, clerical staff, and volunteers. WIC eligibility overview. A parent may qualify for WIC services if they meet all 4 requirements below. They fall into a category, so that's either pregnant, breastfeeding, had a baby within the last 6 months, have a child under the age of 5, so that means foster parents, fathers, grandparents, etc. Experience a pregnancy loss or termination. They must also live in the state of California. They must meet income guidelines. So families who receive Medi-Cal, CalFresh, CalWorks, they automatically qualify for the WIC program. For military families, BAS, the Basic Allowance for Subsistence Income, is the most commonly used income to qualify for military families. And then also they must have a nutrition risk. So nutrition risk is, it basically means an individual has a medical-based or dietary-based condition. So examples of medical-based conditions are anemia, underweight, or a history of poor health pregnancy outcomes. And a dietary-based condition may include a poor diet. Health benefits of WIC. So WIC is a program that encourages early prenatal care for women, leading to better pregnancy outcomes. It reduces infant mortality. It reduces the incidence of low birth weight in babies. It promotes and supports breastfeeding. WIC services. So WIC contributes to healthy birth outcomes by providing supplemental foods, nutrition education, breastfeeding support, and referrals to health and social services for at-risk, low and moderate income women and children. The next few slides will go into detail on all of our 4 services. So WIC supports breastfeeding. Breastfeeding is a major priority for the WIC program. We know how challenging breastfeeding can be, and we're dedicated to supporting your breastfeeding journey. Let's identify how WIC supports breastfeeding. WIC provides guidance, counseling, and breastfeeding education for all of our participants. Just on the screen here, there's a few examples of the information that you can receive via a WIC participant or on our website. WIC encourages continued safe practice of breastfeeding by offering electric or manual pumps, nursing bras, nursing pads, and breast milk storage bags. So a commonly asked question is, can a WIC participant get their pump before they give birth? They cannot. You have to give birth and certify the infant onto our program before we can give you a pump. And all of these items are available while supplies last. So what types of breast pumps does WIC offer? WIC offers a variety of breast pumps and types. Just for an example, the Medela Pump and Style. A participant can receive a Medela Pump and Style if they're working or attending school 20 plus hours per week, and that does include travel time. Both for the Pump and Style and the Harmony, you can keep those pumps, and then at 6 months, you're able to get a new kit for that at no cost. A mother may be eligible for a hospital-grade electric pump in the following situations. They must be enrolled in the WIC program and breastfeeding, the mother-infant separation, medical condition in mother or baby, mothers who are sick or on short-term medications, or they have multiples, as in twins or triplets, or they just need relactation support. So how does one get a breast pump through the WIC program? So for one, again, you have to be on the WIC program. You'll just contact our office at the number listed above. Then you'll receive an agreement. You have to sign a breast pump agreement, and then you'll have to set up a time to pick up a breast pump from one of our local offices. It doesn't have to be your assigned clinic. It could be whatever clinic that has the pump available for you, and usually that is done within the same day. Nutrition education. So WIC offers free nutrition education classes, and they're also now offered on Zoom. You also have the option to have your education via phone or online on wichealth.org. So with WIC, there's a personal aspect of our services that is different from other nutrition programs. We offer a personalized approach to learning and services. We focus on the support through periodic screening, counseling, and needed referrals. Participants can get helpful and useful different information through learning experiences via a one-on-one phone counseling, Zoom, or online classes on topics of their interests. Participants are involved in their own learning and growth when they talk to a WIC staff. Participants can get tailored food benefits based on their family members' health needs and preferences, which can be issued remotely. Food packages. So WIC provides food packages, healthy food benefits that contain important nutrients for women to have healthy pregnancies and assist in the healthy growth of children. Participants are given a shopping guide along with a WIC Foods guide, and it just tells you the benefits that you have received in the category that you're enrolled in. So for an example, for a fully breastfeeding mother, to the left, that will be all the foods that she receives in her package, and then under that, it'll be the infant in their package. And then on the right-hand side is again another category that someone might be in, a non-breastfeeding mother. Those are the foods that she would get along with the food that the infant would get. So we do encourage breastfeeding. Again, that is one of the main things that WIC provides. And if the mother does decide to breastfeed and fully breastfeed, they can receive benefits up to 1 year. So the WIC card. The WIC issues a reloadable WIC card, and it also offers a free app. The WIC card is like a debit card, and it makes shopping easy. WIC can issue foods benefits remotely to the card, so the participants do not have to come to a WIC site to receive those benefits. And once those benefits are loaded to your card, you can immediately see them on the app. So when you go to a shopping trip for your WIC foods, it's much easier now that there's an app because you can scan the food item on your app and it'll tell you whether or not it's WIC approved immediately. Versus back in the day when they had vouchers and you'll have to get to the register and see that that voucher didn't match the appropriate food item, so you have to go back and get a different item. So it makes it much more easy and a seamless transaction at the register for our WIC participants. We also provide formula assistance, so formula packages provided by WIC are supplemental only. We do not provide all the formula a family needs. Formula brands options include Similac and Enfamil plant-based. We also offer therapeutic formula available upon medical request, and WIC can help mothers with milk supply challenges and relactation plans. So if one of WIC contract formulas is not appropriate for a participant, there may be a medical condition warranting a therapeutic formula. So as part of the patient's treatment plan, therapeutic formulas should be covered by the health plan when the clinician provides adequate medical justification. So should a participant be denied coverage by Medi-Cal or any other health insurance, WIC may provide the therapeutic formula, but we will need a letter of denial from the health plan or Medi-Cal. Healthcare and social services referrals is another resource we offer. So we offer referrals to places like CalFresh, food banks, parenting classes, job assistance, and car seat safety. So as long as a participant is relaying any information to their WIC staff, we'll be able to assist them with whatever they may be lacking. Enrolling in WIC. So we already know what services that we provide. So what documentation will we need from you in order for you to enroll? So we would need a valid identification, proof of address, proof of income, proof of pregnancy, and a referral by a medical provider. Now you know what services we provide, we know what documentation you need. Now it's time for you to apply. So how do you do that? You can call or text the information above Monday through Thursday, and then Friday. We also have sites that you can walk into. So if you're interested in visiting us in person, we have 14 sites that you can visit. And then our website is listed below. You can visit our website and see the locations that we offer all over San Bernardino County. Again, my name is Lachey Baines, and I appreciate your time. If you want to stay updated, please follow us on all of our social media platforms. And again, have a great day.